Good afternoon, everyone, and welcome to DCo Talks. And actually, I'll say, in addition, happy National County Government Month. This is among activities for our celebration of counties that we are sharing with over 3,000 counties across the nation as we uplift awareness about what counties do. Today's DCo Talk session for the month of April is on breaking barriers to fight brain tumors. We're excited to have our guest speaker today, and we are grateful for everyone joining us. Give me one second. I'm having some technical difficulties. Okay, here we go. All right. I'm Dawn Dudley, Senior Public Information Specialist for the Durham County Public Information Office, and my coworker, Alicia Watson, Public Information Specialist, is also a part of the team in today's lead for planning. I'll tell you a little bit about what today's program and presentation is about here. But first, let me remind everyone that DCO Talks is an employee-led program designed to foster connection, conversation, and community among Durham County government employees. Our sessions are designed to provide a welcoming space for employees to share experiences, exchange ideas, and engage in a meaningful discussion. And we hope that everyone feels that way today. Today's session is a collaboration with Duke Postdoctoral Association. We're excited to work with them again this month on a presentation. And today's presentation by Kathryn Blethen. She is a Ph.D. and a postdoctoral researcher at Duke University. She will talk about her work on brain cancer. Dr. Blethen will delve into her research that focuses on low-intensity focused ultrasound blood-tumor barrier disruption to enhance drug delivery and efficacy for treatment of primary brain tumors. I want to make sure that we go over some house rules to make sure that we're all on the same page as we enjoy today's presentation. I want to let everyone know that today's session is being recorded. Please keep your microphone on mute unless you raise your hand and acknowledge to open your mic. Please feel free also to post any of your questions for the speaker or about this presentation, any conversations you all like to have as a sidebar in our chat space. We will attempt to get to any questions that are posted by the end of the session. Dr. Blethen, thank you so much for joining us today. You can take over today's presentation now. We promise we're getting together over here. Just be a little patient with us. Thank you.
Thanks for having me, Judy. I'm really excited to share my research. I'm Kat. I work in Jerry Grant's laboratory within the Department of Neurosurgery at Duke University. Today, I'm going to talk about some ways that we're trying to treat brain tumors. So here's an outline for my presentation. First, I'm going to talk about different types of brain cancers, specifically go into brain metastasis. treatment options that are currently available for patients, the problem that's leading to these treatments to fail, which is the blood-brain barrier, and then our solution, which is the focused ultrasound, and get into some of my preclinical research. So there are two types of brain cancers. One is known as primary brain cancer. This is a cancer that starts in the brain and continues growing in the brain. The second type is known as brain metastasis or metastases. So this is a type of cancer that starts elsewhere in the body and then metastasizes or spreads to the brain. So it's going to go from other lung cancer, breast cancer, and then grow in the brain. And this makes up for about 80% of brain cancer patients. So today I'm going to focus on brain metastasis. So like I said, some of the most common cancers to go to the brain are lung cancer, breast cancer, and melanoma or skin cancer. However, it's estimated that about 20% of all cancers will develop brain metastases. And so here is a figure just showing you the percentage of melanoma patients, which is about 50%, or you can think about 2 in 5 patients. Lung cancer, it's about 40%, which is 2 in 5. And breast cancer is 15, which is a little bit less than 1 patient for every 5 that has breast cancer. And unfortunately, brain metastases are becoming more common. This, we believe, is due to better detection, which can be considered a good thing because the earlier we're able to diagnose these, the better the outcomes are for the patients. And I like sharing symptoms of brain metastases so everyone's aware. These symptoms will vary between patients, and they also depend on the location of the brain tumor. So, for example, if the brain tumor is in the area that processes your vision, then you're likely to have issues with double vision or blindness or blurred vision. But the most common symptoms are headaches, memory problems, seizures, numbness, tingling, seizures, nausea and vomiting, slurred speech. And unfortunately, treatment options are quite limited. Because these brain tumors grow aggressively, they require aggressive treatment strategies. So this is usually a combination of surgery, radiation, and chemotherapy. Clinical trials are available. They're quite rare, but they are becoming more common. And unfortunately, no cure is available. So these patients have quite poor outcomes, with most patients developing another brain tumor within a year. So here in the pictures below, I'm showing you MRI images. So this is the best way we can image the brain in patients. So on the far left, you can see a patient on the day of diagnosis. Circled in red is the brain tumor. It's bright white. And then 5 months later, you see that the brain tumor shrinks a little. However, 14 and a half months later, the brain tumor recurs or comes back. So these patients typically live about a year after their diagnosis, which we're trying to extend this much longer. And one of the reasons these tumors are so difficult to treat is the existence of the blood-brain barrier. And so if there's anything you take away from my presentation, I hope it is that the blood vessels in the rest of your body are not like the blood vessels in your brain. On the left, you can see a vessel of the body. So you can look at this. It's as if you're taking the tube of the vessel and cutting it in half, and you're looking down the vessel. So you can see the cells that hold the vessel together, there's space in between them, allowing for blood or any nutrients within the blood to exit the blood and enter a tissue. And then when you look at the right, you see the blood-brain barrier. So these cells that make up the blood vessel are held very tightly together. There's other cells surrounding it, and this doesn't allow many molecules to exit the blood and enter the brain. And this is typically considered a good thing because anytime that you get an infection, or let's say you have been exposed to a toxin, you don't want these things going directly to the brain. So it's a nice barrier, it's really protective, and it allows you to live a healthy life. So really the purpose of this is to keep bad molecules from entering the brain and causing damage. And if you've ever watched Game of Thrones, you can think of the blood-brain barrier as the wall. So the wall protected the White Walkers from reaching civilization and wreaking havoc. So that's kind of similar to the blood-brain barrier. However, this can be a negative thing whenever we think about diseases that affect the brain. It's estimated that about 98% of therapeutics cannot cross the blood-brain barrier. And this means that these drugs have little to no effect in multiple brain diseases, not just brain tumors, but also ALS, multiple sclerosis, Alzheimer's. And so we really need a way to increase the drug's entry into the brain. And in our case, we want them to enter the brain to kill brain tumors. So you may or may not have seen this episode of 60 Minutes. So this guy is Dr. Ali Rezai. He's a neurosurgeon at West Virginia University. And his episode of 60 Minutes was on this really cool technology called focused ultrasound. So Dr. Rezai is using this technology to improve outcomes for Alzheimer's patients. And I love bringing him up as an example because I got both of my degrees from WVU, so go Mountaineers. So this is what the focused ultrasound looks like. It's inside of an MRI bed. It's pretty much just a helmet that you can wear inside the MRI. But the way this works is that the MRI is able to take those images of the brain. And then from there, you can see these green dots are areas where the focused ultrasound has been targeted. And then once you administer the treatment and apply the ultrasound, you'll see opening of the blood-brain barrier, which is shown by these bright white speckles in the brain, the same areas that we targeted. And this technology, it's fairly new. It was just discovered in the early 2000s, and it uses the same sound waves that you see in imaging a baby throughout pregnancy. It's just a little bit of a different power setting. So here I'm going to show you a video of a microbubble being exposed to the ultrasound. So the way this works is that the bubbles are administered into the blood vessels of the patient. And when the ultrasound hits the bubbles, they expand and contract. And this expansion and contraction pushes on those cells lining the blood vessels, allowing for any molecules in the blood to escape and enter the brain. So here's the ultrasound being applied. The bubble is expanding and contracting, getting bigger and smaller. And it's therefore applying pressure to the cells around it. It's really hard to see the vessel, but I promise it's bigger. Yeah. And then that's when the ultrasound starts losing power and is then turned off. Okay. So in patients, the patient is lying on the MRI table. They're wearing this helmet that is the ultrasound. And so they take an image of the brain. That region that we're interested in our case, the tumor, is targeted. Patients are administered the microbubbles. And then the ultrasound is applied to make the bubbles expand and contract. We also call that oscillate. And then because of the oscillations, the blood-brain barrier is opened, allowing for drugs to exit. And this is a really beneficial technology because it increases the drug in a specific area of the brain, allowing the drug to work better, which means it kills the tumor more. And because it's so targeted, this also decreases the side effects because the drug is not going to other areas of the body and wreaking havoc. So the ultimate goal of my research is to improve the lives of patients with brain tumors, because if drugs can't cross the blood-brain barrier, then they cannot kill the tumor. But if we're able to apply focused ultrasound, we can increase the drug entry into the tumor, allowing for better outcomes for patients. This means that the tumors are going to get smaller and the patients are going to live longer lives. And so, yes, this is a very promising technology, but it's not FDA approved yet, unfortunately. So how do we get FDA approval? First, we start off with preclinical research. So this is in a laboratory setting. We do research studies on animals or on cells in a dish. And this allows us to determine if the treatment of interest is useful, if it's going to work for whatever intended purpose we have, and if it's safe. From there, we can move forward to a phase 1 clinical trial. And this is a small human trial that really the goal is to find a good dose that is safe for humans. And then that dose can then be used in a phase 2 clinical trial. So this is using a lot more patients. And this is really to see if the treatment is effective. And then that goes on to a phase 3 clinical trial, which has an even greater number of patients to further confirm that a drug is beneficial and that it is safe. So I work in preclinical research, so I'm going to go through and show you what I'm doing to try to bring this research into the hospital. So we did a preclinical study to look at focused ultrasound with anti-cancer drugs to kill tumors in mice that have brain metastases. So the way we do this is that we implant tumors into the mice. We're able to image the tumors and confirm that they're within the brain. This is circled here in red. And then once we confirm that mice have brain tumors, we then open the blood-brain barrier with the focused ultrasound and administer anti-cancer drugs or chemotherapy. From there, we monitor how long the mice live. So here, if you look at the lines in blue, this indicates a very short survival because it's around about 40 days. Whereas if you look out here to the yellow line, it's closer to about 70 days. So this is what we're looking for, an increase in survival. So on top of survival, we're also looking at the tumor size. So circled in red is the tumor, and you can tell it takes up about half of the brain. So that's a very large tumor. Okay, so for this study, we use Doxil and paclitaxel. They're labeled in these graphs as Dox and Pax. These are just common chemotherapeutics that are used often to treat brain metastases patients. So first, I'm going to show you the control. So you can see in the picture, there's a huge tumor outlined in red. And then whenever we looked at multiple mice within this control group, they had a lot of tumors and they were very large. Whenever we look at focused ultrasound only, they have pretty much the same amount of tumors as a control, indicating that focused ultrasound alone is not enough to treat brain tumors. And then when we look at the cancer drugs, Doxil and paclitaxel, we see fewer tumors. But then when we combine these chemotherapies with the focused ultrasound, we see even less tumors and they're much, much smaller, indicating that this is a promising treatment for brain metastases. When we look at survival outcomes, control mice live only 30 days. The mice that were treated with the chemotherapy lived about 60 days. But whenever we look at the mice that had combined chemotherapy with focused ultrasound, they live around 70 days. So this indicates that mice are able to live longer whenever the chemotherapy is combined with focused ultrasound. And overall, this gives us a lot of hope for the future. There's a lot of research ongoing in focused ultrasound field with various drugs to treat brain tumors. Currently across the world, there's 14 clinical trials for brain tumors with focused ultrasound, and our lab is currently working on initiating clinical trials for pediatric brain tumors at the Preston Robert Tisch Brain Tumor Center at Duke. With, of course, the ultimate goal of seeing more signs saying I am a survivor at our Angels Among Us 5K. So I would like to thank my PI, my boss, Dr. Grant, and all of our wonderful undergraduate students that work in the lab. I could not do this work without them, and our technician, Angela, as well as all of our collaborators. So with that, I will take any questions.
If anyone has any questions at this time, you can either open your mic or you can post your questions here and know that there are questions asked at this point. You want to ask them later. We can ask them later. You can follow up. We actually had one pop up just now. The question is, what does a current treatment cost?
That's a good question. I'm honestly not sure because I do not work a lot on the clinical side. I know that for the clinical trials, we do budget in extra funding from the Angels Among Us Foundation to help cover some of those costs for patients.
Thank you for that question. Are there any other questions for today's discussion?
Donna,
If
I
there
have
are any
one. Can
questions,
you hear me?
again, you can always post to this thread here and ask your questions later, and we'll be sure to pass them on to Dr. Blethen. And also, we encourage you to please share this recording, which we will post to the Durham County YouTube page. I'm going to bring up my PowerPoint again and thank Dr. Blethen so much for your presentation today. It was very informative and insightful. And I'm going to now let Alicia take back over. If you would stop sharing your screen, please. Oh, we have another question. I'm sorry. Oh, we have two more questions. Hold on. The first question is, no, Matt, I wasn't able to hear you. Can you type your question in the chat? That will help me. I'm not certain why I couldn't hear you. We
Can
don't
you hear
have
me now?
mics muted. People can unmute their own. Or actually, can you try one more time now, Matt, to speak?
Can you hear me?
Yes, can hear you now.
Fantastic. Thank you, Dawn, and thank you for this wonderful presentation. I'm just curious with all of the the headlines about research cuts and funding cuts and things that are uncertain. How you see, I don't want to get political or anything, but how you see that affecting cancer research and particularly kind of your field of research at present and kind of down the road.
Thank you. Yeah, that's a great question. Obviously, the cuts have been affecting a lot of institutions nationally, not just Duke. We're trying to be as careful of spending as we can. You know, the focused ultrasound that we have, it is already paid for. So there's at least that. We have the technology. It's just going to be getting the drugs that we can test and paying for the animals and whatnot. But yeah, it's a very difficult time to be doing research right now.
Matt, do you have a follow-up?
I do not. Thank you for the response. Much appreciated.
Okay, thank you so much, Matt. And if there's anyone else who wants to speak, please do. We have to just shut off our microphones in here because we're both in the same room. And so that's why I wasn't able to hear. We weren't able to hear your question initially. So if there's anyone else that wants to open their mic, they can. But we do have two questions before that. The next question is, outside of the focused ultrasound, is there any other way to temporarily open the blood-brain barriers?
Yeah, that's a good question. So the focused ultrasound is probably the most effective way to open the blood-brain barrier. However, radiation treatment opens the blood-brain barrier temporarily, not to the same degree as the focused ultrasound does. And then we also use it's an osmotic mannitol injection. So it's basically able to go into the vasculature, and because the concentration of the mannitol is so different from the blood, it's able to disrupt the vasculature and allow for drugs to enter the brain.
Is there a follow-up, Marcia, to that question? I want to make sure if you had a follow-up. Actually, the next question is posted, may link to, that she said that, thank you for answering. This may link a little bit to the question that was asked before about, I guess, other types of treatment. The person says, is there any data on successful over-the-counter preventative medications?
So over-the-counter preventative medications for brain metastases, I'm assuming. None that I know of. There's not a lot of research on the prevention line that has been promising yet. There are researchers working on prevention of brain metastases, but I will say, depending on the type of tumor that it comes from, for example, lung cancer, about half of the patients already have brain tumors by the time that they get diagnosed with their lung cancer disease.
Unfortunately, Dr. Blethen's computer just died. I think that she may have had something else to add. Do you want me to bring my microphone over to you? Do you have something else you want to say? Okay, she said that there's not a lot to prevent them, and a lot of times those patients already have the brain tumors present. Are there any other questions for Dr. Blethen? The microphone is open at this time for anyone, and so we're able to hear. If there are any other questions, you can present them here in the chat. Okay. If not, we're going to switch over to, oh no, we have one more question. Okay. The question, Dr. Blethen, can you come over here on this side for now, please? Thank you. No, no problem. Don't say sorry. We're sure it's fine. The question is, do you know if Duke has any opportunities for preclinical research for postgrad students with a BS?
Ooh, that's a good question. I think a lot of the opportunities that would be available would be if a specific lab is hiring or willing to have volunteers. So I would look for any positions that may be for like a research technician, or if you're interested in shadowing a specific area of research, then I would recommend directly emailing the director of the lab.
Is that information that we can provide here in our chat at a point, or would you like to?
We can probably share some links offline and you can distribute them that way. We can share like some common places that the links are posted and whatnot.
Okay,
Yeah.
thank you. Thank you. All right, the president, thank you so much.
Yeah.
So we'll follow up with whatever information we can share from the team here from the Duke Postdoctoral Association that will be helpful and beneficial to this conversation. And like I shared before, if you have any other follow-up questions, we can connect with them and share the information as well. Again, thank you, Dr. Blethen.
Thanks for having me.
So, we're just doing some switching over here. All right, we've gotten through Q&A at this point. Again, we really appreciate everyone who joined us today for this informative discussion. Wanted to highlight some other things about National County Government Month. We have an upcoming volunteer day this coming Friday with the Briggs Avenue Community Garden. You can still sign up via the links that have been shared out across the organization. The opportunity, there's not a limit on the number of those who can participate. Just want to share the Briggs Avenue Community Garden provides an urban garden for Durham families to affordably grow healthy food, learn about sustainable agriculture, conserve pollinators, build community, and increase food security. So the volunteer experience will include weeding, watering, planting, seeding, mulching, and a general great workout for anyone who participates. All right. So we're really excited about that. We have already have some people sign up, so feel free to join them this coming Friday. Also, I wanted to share one more thing that we didn't have a slide up for. Tomorrow is the public art tour. And because of the weather, there's potential that we will be delaying that into the first week of May. But we're really excited. And Sarah Martin from our Engineering and Environmental Services team is prepared to present and walk you through downtown and show you some of our commissioned art and beautification in our community. So please be on the lookout if you have signed up for that particular tour. We'll decide by noon tomorrow if we are going to postpone to our rain date the first week of May. As you can see here on your screen, there are other programming that we have lined up for the rest of the month. We are just so grateful to Durham County employees and their participation and desire to learn more about the organization we work for and how we serve the community here in Durham. If you have any questions about our upcoming events or any of the past events, you can always email our employee email address at public_information@dconc.gov. We would love to hear back from you to tell us about today's presentation, what you enjoyed, and what you would like to see in the future. You can scan this QR code here to take the survey and give us feedback. We'd greatly appreciate it. And we can also drop the link in the chat after the presentation. And please feel free again to email us if you have any questions. Alicia and I both thank you again for your participation and look forward to next month's DCo Talk presentation, which we already think we know what it'll be, and we'll confirm and announce that very soon. And we want to thank again our partners at Duke Postdoctoral Program for your participation and contributions to today's discussion.
On a different shaped keyboards. And
All right. Thank you, everyone. I'm going to end today's program now.
Okay.
You'll get spoiled with this really big touch screen once you get used to it.